Welcome back to my channel and welcome back to another video. It's been a long time, I know, but there were no topics that I could cover. But I'm back with another video today. We'll be talking about the COVID-19 virus, and to take us through the COVID-19 coronavirus, I will hand the stage over to Professor Dr. Mohammed Al-Fiki, Professor of Neurosurgery in Alexandria University. So now, here comes the video.
Good day, everybody. Today we'll be talking about COVID-19 for the general public. As a roundup, COVID-19 have imposed a change from closeness to social distancing and internet beating on everybody on Earth. So we need to know what is COVID-19, where it came from, what is the clinical disease, how serious it is, if there is any current treatment or immunization, and can we avoid infection, and what is the future. There are several questions raised. We'll try to answer some of these questions. What is the virus pandemic current status is the topic of this talk. First, do not panic. Two, practice social distancing and wash your hands and use masks. Why do we do that? Because the coronavirus pandemic is highly infective worldwide pandemic disease of a severe upper respiratory and lower respiratory tract infection affecting the lungs severely, the heart, the kidneys, and several organs. It's caused by a new coronavirus 19, which is one of a coronavirus family that mainly affects animals and rarely infects humans. The coronavirus group has caused SARS in 2002, MERS in 2012, and currently it has caused the COVID-19 severe infection that's disturbing the whole world. Now, SARS-CoV-2 is the scientific name of a new strain of coronaviruses that has not been previously identified in humans. Severe acute respiratory syndrome caused by coronavirus 2, the newly described virus, is the name given to the novel virus which started in November 2019. COVID-19 is the name given to the disease associated with this virus, and we will use COVID-19 and corona as synonyms. The start of the current corona pandemic was first reported from a fish market in Wuhan, China in December 2019 as severe pneumonia complicating flu-like upper respiratory tract infection. Reports dated back to November 2019 of sporadic cases. When the disease spreads badly in Wuhan and in China, the WHO declared the infection as a global health emergency on Jan 30th of 2020 when it started to affect so many countries at the same time, and it was reported as a pandemic on March 11th of 2020. China reported its first death in January 2020. And the origin was suggested to be coming from bats, but this has never been confirmed. The novel coronavirus infection have reached Egypt mainly through international tourism, where the first Egyptian case in Egypt was reported from a French health authority that declared that a French tourist who came back from an Upper Egypt trip was tested positive for COVID-19. The first official reported case in Egypt was also for a tourist on February 14th, 2020. This map shows that the disease has left nowhere on Earth unaffected. This is a map that's been published by the World Health Organization, and the size of the dot estimates the relative incidence of cases in each country. Nowhere is safe. Even cruise ships, and it was reported also from an American aircraft carrier. Nobody is immune. So many people were involved, whether rich and poor, famous and unknown. Prince Charles of UK and Boris Johnson were both infected with the virus and recovered luckily. This graph shows the worldwide distribution of COVID-19 cases, showing that there is over the time, and you can see the changes there. About 6.5 million cases were infected as of June 4, 2020, and in Africa, about 162,000 cases were reported, mainly from South Africa, 37,500, from Egypt, 28,500, and also from Nigeria, Algeria, and Ghana. In Asia, 1.5 million cases were reported, mostly from India, Turkey, Iran, Saudi Arabia, and Pakistan. From America, 3 million cases were reported, mainly from the United States, Brazil, Peru, and Mexico. The disease is highly lethal, and this graph again from the WHO shows the number of deaths all over the world. 4,000 and half deaths from Africa, 23,000 deaths from Asia, 172,000 deaths from America, and 177,000 deaths from Europe, Oceania, and others are rarely reported rarely death. The epidemic, the virus itself, is a new member of an 8-member family of a spiky, single-stranded RNA viruses collectively called the coronavirus because they have this strength and these spikes, and will tell you the importance of these spikes in how the virus infects people. Most of the coronaviruses do not affect humans. It infects birds, bats, and feline. Only SARS and MERS and now COVID-19 do infect human beings. SARS was started in Guangdong, China in November 2002 and has gone by July 2003, and MERS was started in Camden, Saudi Arabia in April of 2012 with several episodic peaks mainly in the Middle East. These two coronavirus infections are different from the novel coronavirus 19 that because the new virus mutates very quickly and have an extremely high infectivity. That's why it is extremely widely spreading and markedly lethal, while less than 900 mortalities were reported from SARS and MERS. There are 500,000 deaths now encountered so far from COVID-19. This is how the virus affected the tissues. The RNA of COVID-19 virus binds to what's called an ACE or an ACE inhibitor that's present in the lung, heart, and the kidneys. On the surface, when it binds to this receptor, the receptor will carry it into inside the cells. When it is inside the cell, it starts to replicate in large numbers and supermaster the cells to produce more and more of the virus particles. And that's why these organs are the organs that are highly affected. And in this case, it will destroy the lung, the myocardium, and will cause vasoconstriction and increase vascular permeability and what's called disseminated intravascular thrombosis. So the virus could be transmitted either by direct route, as you see here, or by an indirect route. The direct route is airborne, direct droplets from person to person, or by hand contamination, and then from the hand contamination affects other persons. The person sneezes in his or coughs in his hand or in the air, and the droplets containing the virus will drop on surfaces like doorknobs or any surface, and that's stayed there where somebody who's healthy comes and touches the door or the doorknob or the surface again, and then starts to touch his nose or mouth or his eye, and in this way transmitting the infection to its mucous membrane where the virus will invade the mucous membrane. The typical course of the infection. Uh, we know that the patient will remain asymptomatic with an incubation period of 2 to 15 days with an average of about 5 days. And unfortunately, the patient might be infective to others 1 to 2 days before the onset of symptoms, up to 37 days, with a mean infectivity of about 20 days. The disease generally is self-remitting and mild. 50% are completely asymptomatic, and patients may never know that they ever had the disease. The majority of the asymptomatic patients pass unnoticed, while 98% of people who have symptoms will present with fever, fatigue, dry cough, shortness of breath, dyspnea, and muscle aches in about 30%, and sore throat and loss of smell is a very common. Rare symptoms are diarrhea, nausea, dizziness, headache, while abdominal pain and vomiting are extremely rare. This ensures in severe cases after about 5 days in about 15% of patients due to lung infiltrates, and unfortunately, in about 5% of patients, it may progress rapidly to lethal acute respiratory distress syndrome and death. This is what we see on a chest CT, and the question is, there is a value of laboratory tests. Diagnosis depends mainly on the clinical presentation just described, on CT findings, and on a positive swab culture showing the RNA of the virus, what's called the PCR. Diagnostic tests are not 100% diagnostic, but the best is the chest CT and the absolute lymphopenia, which is a severe depression of the number of special types of white blood cells known as the lymphocytes. The earliest blood alteration is the absolute lymphopenia. And the chest CT is an early, very sensitive test where special densities appear called GGO. The immunological tests such as IgG, IgM are good, negative, and strong false positive. Even PCR is overall 170% sensitive as a positive test in serum. It's 90% positive if it is taken from a bronchial lavage, 60% sensitive in nasal swabs, and 30% sensitive in pharyngeal swabs. General tests such as CBC, creatinine, and liver functions are registered for having a baseline for organ function, and the D-dimer, troponin, and CRP in old patients as inflammatory and destructive manifestations are needed for assess the severity of the condition. So mainly the treatment is always supportive. No specific antivirus treatment have fulfilled the proven scientific statistical requirements to recommend it as a strong guideline treatment. Supportive measures are paramol, pravutine, lactoferrin, zinc, zithromycin, multivitamin, and anticoagulants and antithrombotics may be needed in late stages in special patients who are hospitalized. It's important to know whom to direct our attention to in order not to overburden the healthcare system. And the population at risk are people not following a healthy lifestyle, including exercise and balanced rich diet in vitamins, vegetables, fruits, proteins, carbohydrates, and fat, either due to nutritional restrictions such as in chronic chest disease, asthma, diabetes mellitus, cardiac, renal, or liver disease, and those immunocompromised due to chemotherapy, radiotherapy for cancer patients. These patients are generally subject to more infections and are more prone to develop more severe disease with a worse prognosis. How serious is the infection in general? Remember, 80% of cases are mild with zero mortality. So it's not that severe. Severe disease is present in 15% who need hospitalization due to dyspnea. They require some sort of respiratory support, and only 5% have critical disease. Unfortunately, in this group, there is a 50% mortality because of multi-organ respiratory and respiratory failure or septic shock. This was thought to be more prevalent in older comorbid population with hypertension, diabetes, chronic obstructive pulmonary disease, liver disease, and cancer. There is a definite age-related mortality in COVID-19 infections. Although mortality may occur at any age, it's extremely rare in young and it's higher in older age. Up to 5 years, up to 50 years, mortality is 0.5% and it jumps to 3.5 between 60 to 70 years, while it tops at 8% between 70 to 80 years, and it doubles to 15% in older patients due to their premorbid condition. So what is the future and what are the facts that are helpful to protect ourselves as long as there is no current treatment? The trick is wear mask, sterilize, and keep social distance. Why mask? Coronavirus airborne droplets particle size are 0.25 to 2.5 microns in diameter. Wearing a surgical mask would filtrate 70 to 80% of submicron particles, while the N95 masks filtrates more than 99% of particles larger than 0.1 micron, including the coronavirus particles. And they are better masks. How long the virus survives on surfaces? This is a study that showed that this virus may stay alive for up to 3 days on a stainless steel or plastic and up to 24 hours on cardboard. The virus destroys our tissues, but we still can destroy the outer membrane made of glycoprotein, of glycolipids on the outer surface of the virus, of the phospholipid layer, keeping the virus RNA inside. So we can use surfactants and detergents, so like soap, shampoo, cleaning agents, alcohol with a concentration above 70%. Or we can use disinfecting chemicals like bleach, hydrogen peroxide, and quaternary amines to wash or wipe the surfaces that are exposed to the presence of the virus. How do we protect ourselves and loved ones? Keep social distancing and frequent hand wash with water and soap. You do not need an antibacterial soap, and wear mask when in crowd or places frequently or heavily visited by different people. Wearing gloves is also a good idea, but avoid touching the eye or the face with the gloved hands, since you may transfer the infection in the same way. Better wash your hands. Food and blood products do not transmit the virus, but sneezing and close contact does. These are some pictures showing the rules of social distancing when you are in public, when you are in a public transport, when you are in a workplace, when you are in a meeting, when you meet somebody, you know, and when you are waiting in line inside or outside supermarket or a bank, and when you are even on a park or praying. Wash your hands and clean your hands frequently is the secret, and wipe the surfaces that you touch or others might touch. And keep social distancing as if you are in a bubble. Wear masks, sterilize. You may use goggles if you are exposed to people, if you are in a healthcare situation and you are exposed to people, and keep social distancing in whatever type of prayer you are doing. Thank you very much for your attention.
I would like to thank Professor Dr. Mohammed Al-Fiki for the contribution that he contributed to this video. And I would also like to thank him for lending his voice to the video. Very, very generous of him. Thank you very much. Please do not forget to comment, like, and subscribe, and please stay tuned to my channel for more upcoming content. And if you enjoyed the video, please let me know in the comment area below, and I will see you on my next video. Thank you. Bye-bye.